Colitis. Introduction. The colon, or large intestine, is a hollow, muscular tube that processes waste products of digestion from the small intestine, removes water, and ultimately eliminates the remnants as faeces, stool, through the anus. The colon is located within the peritoneum, the sac that contains the intestine, located in the abdominal cavity. Definition. Colitis describes inflammation of the inner lining of the colon and can be associated with diarrhea, abdominal pain, bloating, and blood in the stool. Colitis is a chronic digestive disease characterized by inflammation of the inner lining of the colon. Infection, loss of blood supply in the colon, inflammatory bowel disease, IBD, and invasion of the colon wall with collagen or lymphocytic white blood cells are all possible causes of an inflamed colon. Different types of colitis. There are many different forms of colitis, including ulcerative colitis, Crohn's colitis, diversion colitis, ischemic colitis, infectious colitis, fulminant colitis, collagenous colitis, chemical colitis, microscopic colitis, lymphocytic colitis, atypical colitis. Causes. Infectious causes of colitis. Many bacteria reside in the colon. They live in harmony with the body and cause no symptoms. However, some infections can result if a virus, bacteria, or parasite invade the small and or large intestine. Common bacteria that cause colitis include Campylobacter, Shigella, E. coli, Yersinia, Salmonella, Clostridium difficile, Entamoeba histolytica. Ischemic causes of colitis. The colon can be thought of as a hollow muscle. It requires a normal blood supply to deliver oxygen and nutrients for the muscle to function normally. When the colon loses its supply of blood and becomes ischemic, isch is equal to restricted plus emia is equal to blood supply, it may become inflamed. Ischemia or lack of blood supply causes inflammation of the colon leading to pain, fever, and diarrhea. Bowel movements may contain blood. Inflammatory bowel disease, IBD, and colitis. Ulcerative colitis and Crohn's disease are the two types of inflammatory bowel disease, IBD, that cause colitis. Crohn's disease and ulcerative colitis are considered autoimmune diseases. The body's immune system attacks itself. Microscopic colitis. There are two types of microscopic colitis, 1. Collagenous colitis and 2. Lymphocytic colitis. Either collagen or lymphocytes, a type of white blood cell, infiltrate into the layers of the wall of the colon, presumably as a result of inflammation. Allergic colitis in infants. In infants younger than 1 year of age, colitis is often due to allergies to cow or soy milk. Pathophysiology. Clinical manifestations. General signs of colitis can include intense pain, tenderness in the abdomen, depression, rapid weight loss, aches and pains in the joints, loss of appetite, fatigue, changes in bowel habits, increased frequency, fever, swelling of the colon tissue, erythema, redness of the surface of the colon, ulcers on the colon, in ulcerative colitis, which may bleed, mucus and or blood in stool and rectal bleeding, diarrhea, which may occur, although some forms of colitis involve constipation so the stool and bowel movements may appear normal. Other symptoms may include gas, bloating, indigestion, heartburn, gastroesophageal reflux disease, cramps, bowel urgency and many other uncomfortable aches in the gastrointestinal system. Diagnosis. History taking. In patients with abdominal pain and diarrhea, it is important to find out when the symptoms began, how long they have lasted, whether they come and go, and what makes them better or worse. Travel history is important, especially if the patient has recently visited an area with potentially contaminated water supply or poor food hygiene. Physical examination. Examination of the abdomen includes palpating or feeling for tenderness and masses in the abdomen. Bowel sounds are often listened for with a stethoscope. The exam also may include a rectal examination to test the stool for blood and feel for a possible rectal mass. Biopsy. Rectal and colonic biopsies should be examined to find the nature of the inflammation, ulcerative colitis versus CD, collagenous colitis or microscopic inflammation if macroscopic appearance is normal, and infection. Blood tests. Tests for anemia or infection. The doctor may suggest blood tests to check for anemia, a condition in which there aren't enough red blood cells to carry adequate oxygen to tissues, or to check for signs of infection from bacteria or viruses. Fecal occult blood test. Client may need to provide a stool sample so that doctor can test for hidden blood in stool. Hypoalbuminemia suggests severe disease with denutrition. The best markers of inflammation severity are elevation of the C-reactive protein and platelet count. Anti-Saccharomyces cerevisiae antibodies, ASCA, are positive in 50 to 60% of CD patients, while anti-neutrophil polynuclear antibodies, ANCA, are positive in 50 to 60% of UC patients. Endoscopic procedures. Colonoscopy. This exam allows doctor to view the entire colon using a thin, flexible, lighted tube with an attached camera. During the procedure, doctor can also take small samples of tissue, biopsy, for laboratory analysis. Sometimes a tissue sample can help confirm a diagnosis. Flexible sigmoidoscopy. The doctor uses a slender, flexible, lighted tube to examine the rectum and sigmoid, the last portion of the colon. If the colon is severely inflamed, the doctor may perform this test instead of a full colonoscopy. Upper endoscopy. In this procedure, the doctor uses a slender, flexible, lighted tube to examine the esophagus, stomach and first part of the small intestine, duodenum. While it is rare for these areas to be involved with Crohn's disease, this test may be recommended if client is having nausea and vomiting, difficulty eating or upper abdominal pain. Capsule endoscopy. This test is sometimes used to help diagnose Crohn's disease involving the small intestine. Client swallows the capsule that has a camera in it. The images are transmitted to a recorder he wears on his belt, after which the capsule exits body painlessly in stool. Balloon-assisted enteroscopy. For this test, a scope is used in conjunction with a device called an overtube. This enables the doctor to look further into the small bowel where standard endoscopes don't reach. This technique is useful when a capsule endoscopy shows abnormalities, but the diagnosis is still in question. Imaging procedures. X-ray. If client has severe symptoms, the doctor may use a standard X-ray of abdominal area to rule out serious complications, such as a perforated colon. Computerized tomography, CT, scan. Client may have a CT scan, a special X-ray technique that provides more detail than a standard X-ray does. This test looks at the entire bowel as well as at tissues outside the bowel. CT enterography is a special CT scan that provides better images of the small bowel. This test has replaced barium X-rays in many medical centers. Magnetic resonance imaging, MRI. An MRI scanner uses a magnetic field and radio waves to create detailed images of organs and tissues. An MRI is particularly useful for evaluating a fistula around the anal area, pelvic MRI, or the small intestine, Mr. enterography. Unlike a CT, there is no radiation exposure with an MRI. Radiology barium enema swallow. USG. Medical management. The goal of inflammatory bowel disease treatment is to reduce the inflammation that triggers signs and symptoms. Anti-inflammatory drugs. Anti-inflammatory drugs are often the first step in the treatment of inflammatory bowel disease. Anti-inflammatories include corticosteroids and aminosalicylates, such as mesalamine, Asacol HD, Delzicol, others, Balsalazine, Colazole, and Olsalazine, the pain term. Which medication you take depends on the area of your colon that's affected. Immune system suppressors. These drugs work in a variety of ways to suppress the immune response that releases inflammation-inducing chemicals in the intestinal lining. For some people, a combination of these drugs works better than one drug alone. Some examples of immunosuppressant drugs include azathioprine, azcin, imurin, mercaptopurine, purinethal, puricin, cyclosporine, gengraf, Naoral, sandimune, and methotrexate, Trixil. One class of drugs called tumor necrosis factor, TNF, alpha inhibitors, or biologics, works by neutralizing a protein produced by immune system. Examples include infliximab, Remicade, adalimumab, Humira, and golimumab, Simponi. Other biologic therapies that may be used are natalizumab, Tizabri, vedolizumab, Entyvio, and ustekinumab, Stelra. Antibiotics. Antibiotics may be used in addition to other medications or when infection is a concern, in cases of perianal Crohn's disease, for example. Frequently prescribed antibiotics include ciprofloxacin, Cipro, and metronidazole, Flagyl. Other medications and supplements. In addition to controlling inflammation, some medications may help relieve signs and symptoms. Depending on the severity of IBD, doctor may recommend one or more of the following. Antidiarrheal medications. A fiber supplement, such as psyllium powder, metamucil, or methylcellulose, Citrucel, can help relieve mild to moderate diarrhea by adding bulk to stool. For more severe diarrhea, loperamide, Imodium 80, may be effective. Pain relievers. For mild pain, doctor may recommend acetaminophen, Tylenol, others. However, ibuprofen, Advil, Motrin IB, others, naproxen sodium, Alev, and diclofenac sodium, Voltaren, likely will make symptoms worse and can make disease worse as well. Iron supplements. If client has chronic intestinal bleeding, he may develop iron deficiency anemia and need to take iron supplements. Calcium and vitamin D supplements. Crohn's disease and steroids used to treat it can increase risk of osteoporosis, so you may need to take a calcium supplement with added vitamin D. Non-pharmacological treatment. To avoid smoking cessation. To reduce alcohol consumption. To avoid the use of NSAIDs. To avoid spicy and fried oily food. To take fiber-rich diet as tolerated that include tender cooked vegetables, canned or cooked fruits, and starches like cooked cereals and whole wheat noodles and tortillas. To incorporate more omega-3 fatty acids in the diet. These fats may have an anti-inflammatory effect. They are found most probably in fish. Nursing management. Nursing diagnosis. Diarrhea related to inflammatory process. Acute pain related to increased peristalsis and GI inflammation. Imbalanced nutrition less than body requirements, related to dietary restrictions, nausea, and malabsorption. Activity intolerance related to generalized weakness. Anxiety related to impending surgery. Ineffective coping related to repeated episode of diarrhea. Risk for impaired skin integrity related to malnutrition and diarrhea. Interventions. Enhance nutritional status. Promote nursing care of the client who is receiving nothing by mouth, receiving oral fluids, or on total parenteral nutrition during an acute exacerbation. Assist for fluid and electrolyte imbalance. Administer for fluids and electrolytes as indicated. Encourage a low residue, high protein, high calorie diet with supplemental vitamin therapy and iron replacement. Implement measures to treat diarrhea or constipation. Minimize pain. Address and mediate the client's pain. Promote intermittent rest periods and bed rest when the client has acute exacerbations. Promote client and family teaching. Encourage the client to seek psychotherapy to determine the factors that distress the client and how to deal with these factors to prevent exacerbations. Provide client teaching covering the importance of good nutrition and adequate fluid intake. Stress management techniques. Perianal skin care. The need for follow-up visits to the healthcare provider. Administer medications. It includes antidiarrheals, corticosteroids, antibiotics, antispasmodics, and anticholinergic and opioid analgesics. Complications: severe bleeding, a hole in the colon, perforated colon, severe dehydration, liver disease, rare, bone loss, osteoporosis, inflammation of skin, joints and eyes, an increased risk of colon cancer, a rapidly swelling colon, toxic megacolon.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.